if you have a practice in dental or health practice and you are seeing challenges right now, this is the biggest problems facing dental and health practices. So we have staffing shortages. You mentioned that is not a problem for you at all. We mentioned insurance billing issues. We mentioned rising operations costs, patient acquisition and retention, compliance and regulations, technology challenges, patient financing, corporate consolidation, and administrative overload. Of course, you solve several problems here in this chart, but today we're going to focus on the patient acquisition and retention because, as we've said before, sales solve everything, all the problems. What do you think? Do you agree that these are some of the challenges that your clients are basically mentioning right now?
Yeah, every little thing that was mentioned in the boxes that you have are very similarly. Other business owners are going through the same problem. It's not particularly about healthcare sectors, but it is a theme of problems with F&B, with e-commerce business, with other local or service-based businesses are going through the same problem. It's just that the name of those activities are a little bit different, right? But those and what I thought was very interesting in that bubble was the corporate buying these smaller businesses and practices, and they're able to do this because they have the infrastructure, and they call it the MSO or DSO for dental practices. Is that they have the centralized infrastructure to provide marketing, provide HR, because they could switch staff around in different practices. They have the supply chain. They have all the supplies where they can distribute to for a cheaper price because they're buying a massive volume. Now, so for dental practice owners, it may seem very lucrative, at the same time very efficient to partner with DSL. But what they're I guess the caveat here is you're losing your decision power, right? Your decision making power, and that you don't have the full ownership of how the practice should be ran, right? So again, the platform and the infrastructure I'm trying to create, right? The ecosystem I'm trying to create here is very similar to DSO or MSO, but without giving up their equity nor ownership of their practice. We are letting doctors be doctors, or business owners to be business owners, and chef to be chefs, right? And they're not dealing with payroll. They're not dealing with all these tax problems. They're not dealing with how do I get new customers? Because I'm sure they've studied all these years to become a doctor, not to become a marketing expert, which now you have to kind of be, you have to put yourself in, right? There's a lot of things that we tackle in that bubble, but we can certainly talk about the patient acquisition and retention strategy that many people kind of forget.
Business Money Podcast. Business Money Podcast. Fearless. Business Money Podcast. Fearless. Business Money Podcast.
Welcome to the Business Money Podcast, where intelligent financing meets strategic thinking. And we got to think horizontally, vertically, how we can help businesses, SMEs, small, medium enterprises, dental practices, doctors' practices, how to really better their business. And today we have a special guest that he's going to tell us all about that, all about how to help practices really scale, expand, and use really properly the resources available. Eddie Yee with Ditans Group. Eddie, how are you today?
Thank you for having me. I'm doing great out here in Los Angeles, California. Weather's been always nice out here. It's a great place to start your own practice here.
I am an ex-Californian, my friend. So I love California. I mean, I still have great friends and everything out there. But Eddie, I want to make a brief introduction about you, who you are, what you do, and how you help businesses, if you don't mind. So Eddie Yee is the CEO of Ditans Group, a digital marketing and business consulting firm specializing in SEO, AI-driven search optimization, GEO, PR placements, and growth strategy. So he helps businesses increase visibility across Google and AI platforms like ChatGPT and Gemini, focusing on lead generation, brand authority, and scalable marketing systems across healthcare and local service industries. So you help businesses really with a lot of what right now they're really interested in understand how to use all these tools that are coming up right now to help businesses scale. Eddie, tell us a little bit about your trajectory, platforms, and what you do with your firm.
Yeah, so Ditans Group is just one of the companies that I own. I make this into like a one-stop shop business solutions platform. And what I mean by that is usually there's mostly about 3 to 4 different pillars that business owners can really outsource. And usually when they're just a entrepreneur, they're usually the one who's dealing with the marketing side, sales, HR, deliverable and productions, R&D, administration, all that stuff, right? So if their team is not, if there's no dedicated team to tackle those tasks, there's usually something that's going wrong, right? And that's kind of where I can come in and really tackle everything very thoroughly. When you want to scale, when you want to have, first, it always starts with marketing, right? When you have a business, the closest activity that is closest to sales, which will drive your company, is marketing. So if you're saying your sales is going down, maybe the closest thing that you should look at is how well is my marketing going, right? Um, and so I have a digital marketing company that kind of and again, it's not like a one size fit all, but we try to tailor based on the industry, based on the type of business you're running. And we make sure that everything is optimized as far as the digital marketing campaign goes. And then when you have the flow of new patients or new customers, if you're a local business, then usually the HR or the human capital will do those activities to produce or make the deliverables. And that's where when my HR department, my HR company can come in and support with the sourcing and vetting and onboarding, background checks and whatnot. As far as the HR goes, we can find the people. Finding people is not going to be an issue for us. It's just a matter of how you want to employ them, whether through my company and then contract them out to the business owners, or you want to just have us become a headhunter and source the candidates for you. And of course, when this cycle repeats over and over and over, this is where you start doing R&D. You're gonna get feedbacks from customers. You're gonna get feedback from your employees. So you start looking to improve and optimize and try to cut costs. And you should really keep thinking of improving always, right? And nowadays, it's usually done by machines or collect a lot of data if it's a repetitive work cycle that you're doing, and see where you can cut costs and try to just be more efficient about it. And that's when my T company kind of comes in and help you with the data science, optimization, automation, and such. Yeah.
I love it because and I think your practice actually functions very similarly to what Evermore Capital does. So we're business capital and consulting. Why? Because most of the time people ask for capital, but then we look at all of the other marketers that are really affecting the company, and we see basically where all the nuts and bolts are not being tightened, or all the brokenness of the whole processes, operations, contracts. And this is all basically part of like the things that we don't think about that affect really the value and profitability of a business. I want to show you a chart that is very important, for people that are looking at us right now, and for them to understand if you have a practice in dental or a health practice, and you are seeing challenges right now. This is, if you're looking at the screen, this is the biggest problems facing dental and health practices. So we have staffing shortages. You mentioned that is not a problem for you at all. We mentioned insurance billing issues. We mentioned rising operations costs, patient acquisition and retention, compliance and regulations, technology challenges, patient financing, corporate consolidation, and administrative overload. Of course, you solve several problems here in this chart, but today we're going to focus on the patient acquisition and retention, because as we've said before, sales solves everything, all the problems. What do you think, do you agree that these are some of the challenges that your clients are basically mentioning right now?
Yeah. Every little thing that was mentioned in the boxes that you have are very similarly. Other business owners are going through the same problem. It's not particularly about healthcare sectors, but it is a theme of problems with F&B, with e-commerce business, with other local or service-based businesses are going through the same problem. It's just that the name of those activities are a little bit different, right? But those and what I thought was very interesting in that bubble was the corporate buying these smaller businesses and practices. And they're able to do this because they have the infrastructure, and they call it the MSO or DSO for dental practices, is that they have the centralized infrastructure to provide marketing, provide HR, because they could switch, staff around in different practices. They have the supply chain. They have all the supplies where they can distribute it for a cheaper price because they're buying a massive volume. Now, so for dental practice owners, it may seem very lucrative, at the same time very efficient to partner with DSL. But what they're, I guess the caveat here is you're losing your decision power, right? Your decision making power, and that you don't have the full ownership of how the practice should be ran, right? So again, the platform and the infrastructure I'm trying to create, right? The ecosystem I'm trying to create here is very similar to DSO or MSO, but without giving up their equity nor ownership of their practice. So that's kind of and at the end of the day, we are letting doctors be doctors, or business owners to be business owners, and chef to be chefs, right? And they're not dealing with payroll. They're not dealing with all these tax problems. They're not dealing with, how do I get new customers? Because I'm sure they've studied all these years to become a doctor, not to become a marketing expert, which now you have to kind of be, you have to put yourself in, right? Yeah, again, we could talk about, there's a lot of things that we tackle in that bubble, but we can certainly talk about the patient acquisition and retention strategy that many people kind of forget.
That's great. Yeah, we should focus on that. But I do love that you just said one thing, which is I want to give you an example, just basically to give it a little bit of context. So so we work with, of course, dental practices and clinics and doctors, that are trying to scale. Well, what happens? Of course, like they're constantly, okay, Andres, we want capital because we want to open another endodontics clinic, on the north side of the city. Then okay, okay, so I gotta now position myself being Mondays in this location, Wednesdays this location, Fridays in this location, and then start hiring, basically outsource now dentists and endodontics and all of those things, for basically the clinic really to run. Well, they get to a point of basically it's asphyxiation of capital and resources, right? Because they're trying to do everything. And let's say an office manager is doing everything you mentioned, patient acquisition and retention. They're focusing on that when it's not focusing more of hey, let's get the wheels rolling of the actually company. Then they can use you. They can basically, talk to you and outsource that piece so they can really focus on providing excellent customer service and make sure that everything, all the gears are oiled and basically functioning properly. Does that make sense?
Yep. That's exactly how it should be run.
Perfect. So give us an example. Okay, so let's say, and I'm this client, and I have a dental practice, or I have let's say I'm let's say healthcare or dental, and I'm trying to scale and I need help with patient acquisition and retention. I'm going to call you. Then I'm going to look at you and I'm going to say, okay, what is this 18-year-old going to tell me about patient acquisition and retention? By the way, tell the audience how old you are, because if I don't say it, people are not going to believe it. All right.
Well, I'm 39. I'm about to, I'm just 1 year away from becoming 40, 30, 40. Yeah, I'm 39.
Thank you for mentioning that, because I'm like, okay, I need to say it because you're blessed with the greatest genes. Okay, by the way, Brian Johnson is looking for you and he wants your blood. All right. So let's talk about that, because, okay, so what is the first question that you will ask, let's say, owner of a practice?
So, how earlier I mentioned about every practice have their uniqueness, and it shouldn't be just one size fit all. So these type of questions, the intake questions, are very important to kind of make a determination of how I'm going to approach this situation. So first I will find out exactly what type of this practice is. Is it HMO driven? Is it PPO driven? Is it fee for service? Or is it like a Medi-Cal, right?
Private
Where
pay?
you're serving, or Medicaid, for more federal term, where you're serving more underserved population with limited resources, right? So depending on the type of patient pool that you're dealing with, because marketing is all about going to places where people are hanging out, right? Yeah, if Medi-Cal or Medicaid patients go to certain locations to find out some resources that is available for them, we just got to be there, right? To track new Medicaid patients. If PPO office, or if PPO, as we all know, it has a flexibility of choosing any doctors as long as they're credentialed with that insurance company. We just gotta be where patients who are PPO enrolled, look for dentists or look for doctors. And typically for people who has that much of a flexibility, usually goes to internet or they go to insurance provider list and see whoever is the closest or whoever has the scope of services that is aligned with their needs, right? Again, HMO typically works like there's a gatekeeper, and then you have to get a referral from your gatekeepers to kind of get that. So you just then need to have a good relationship with these type of gatekeepers to get these referrals. But let's just kind of narrow down as far as this common dental practices that someone would just open in downtown LA, right? Typical situation looks something like this: is that this person wants to probably capitalize on patients that are probably fee for service, because there's no restriction on when you can do this, right? So they will probably want to capitalize on fee for service, but usually fee for service, meaning cash patients, um, it's a very competitive landscape. So you want to have a distribution of certain percentage as a fee for service, certain percentage as a PPO insured patient. And then if these pool do not provide you the cash flow, then you start looking at tapping into resources like Medicaid or HMO, because they will supply you with patients. So let's look at PPO or fee for service. So what do people do as everyday consumers like you and me? And what will we do to find out or find for dental practice, or even like a tire shop? If you have a puncture tire, what would you do if you have all the flexibility to choose any medical provider? What would be our consumer behavior be? Again, we have to look at those things and we have to be there, is my kind of the go-to market strategy. And there's already a lot of established platforms such as Google, Yelp, ZocDoc, Trustpilot. Again, whatever people use to find out and get information about a dental practice or any business for that matter, there's essentially a decision-making tree that people kind of in their head, they don't really think about it, but it just kind of naturally happens. There's a schema that we all live in, right? If I want to buy a phone, a brand new phone, let's say I broke my phone, okay? In my head, there's a decision tree that's happening, okay? In the world, there's all kinds of phones. So in my head, what do I do? So the first decision-making tree is, what platform what operating system do I want to use? Is it the iPhone? Is it Android? Is it the Windows? Whatever the case might be, right? And then you narrow these choices down, right? If it's a Mac operating system, then obviously you have to go with an Apple line. If you're in an Android system, then you have to go with an Android system decision tree, right? So you look at Android, and then there's a bunch of different brands that provide Android phones, right? So now you start looking at different Android phones and you compare different brands and different specs of the devices, and then you narrow it down to, oh, what's my budget, right? Or maybe budget on the top, and then you kind of narrow those things. But the point is that you go through these decision-making trees and you start, questioning yourself. And a lot of times people use these questions and start asking on internet. Now that we have an AI, you bluntly ask these things like to AI, right? What is the best Android phone? And then and they'll probably list out all these things. And then you now finally have chosen a product that you would like to purchase. Now when you're ready to make a purchase, people typically make who's ready to spend the money will ask certain questions that would trigger the actions right afterwards. So the very top of the question was, what is the best operating system for phones? That is not the decision-making questions. But when you're asking who provides the cheapest Samsung Android Galaxy 24 near me, that means this person is ready to spend the money. So using that concept, you start applying to these dental practices. So you probably want to start blog about the best dentist in Los Angeles, downtown Los Angeles, best implant specialist in downtown Los Angeles. And if you get indexed by Google or Yelp or any of these online platforms that people typically use to choose their dentist, you're going to get those customers organically, right?
That is a great analogy because like I think you say, okay, if you're entertaining the idea, you are a lot more general in your questioning, and then but when you're ready, you ask very specific because you have already done the research of what operating system and everything. Applying that analogy, and and you're mentioning, let's say, a practice, in downtown LA, looking to, okay, how can I attract and acquire and retain, a lot more clients? You mentioned a lot of the tools that of optimization of really I guess it will be what we call the reputation, kind of like, the reputational aspect of the firm out there. How do you do that? How do you help these clients? Because, or give me a little bit about of how an example of how you do that. You don't have to get specific, but at least the process of how you will attack it.
Okay. So it works kind of like this. You have a wisdom teeth that is bothering you, and you want to get this removed as soon as possible, or you want to do something about it, whether that's removal or just get some painkiller, whatever the case might be. So you start typing away wisdom teeth removal, wisdom teeth dentist, right? The keyword that is very, very specific of what your pain points are, right? What your problems are. When you're Googling or doing AI search, whoever and the AI will kind of populate the answer based on what you're asking specifically, right? But the coolest part here is that when people are giving you reviews, and these are your customers, right? Giving you specific reviews, everything they mention on Google, Yelp, or Trustpilot or BBB, these online review platforms gets indexed and gets cited, okay, to use to make those suggestions. So now then we have to somehow ask these customers to specifically talk about the services they've received and give us a genuine feedback about it, right? Without actually stealing their phone and writing the review for your own company, because that would be illegal, right? So what we've done is we know when patient came, let's say patient John Doe came in for third molar extraction. Okay, that's a very specific keyword that people would never use to write a review because they generally say, or they don't even leave a review in the first place.
I don't think people want to go through 3 times the same pain.
Right. So what they do is great doctor, if they ever do leave a review, great doctor, awesome staff, awesome dental practice. That does not give you any value as far as what you want to be known about. You want to be known about third molar extraction dentist, right? So what we do is we create, when patient John Doe comes in, he or she will receive the services and will be walked out of the practice. So within 1 hour of walk out, the front desk person or the system would trigger a review request link to directly to their phone. Because if you verbally ask them as you're leaving the restaurant, they'll the servers will ask you, can you please give us a review? What do we do? It's like, okay, we'll do it, and they would never get to it. The reason why is, again, we're lazy. We don't want to do it. We don't want to put in the extra time and energy and effort to do those work. So what do? Is that we want to make it convenient for customers to give a review. So we do it in a combination. So you verbally ask them to kind of show your genuine request, and then secondly, when they have a convenience of the review link landed on their text box inbox, then they can click it, right? And the AI will already write the review for them in such way that this patient was served by who and receives certain services. And the patient or the consumer can add, subtract, and modify the review that has written for them. And review basically asks, does this reflect your experience? And it's all consumers kind of it's on their decision making. They can make the decision whether to copy and paste directly to the review platforms that is available. So now the reviews will say, I went to so-and-so best practice and got my third molar extractions done. And it was great, pain-free and anxiety-free. It was great. Something like that, right? And was it us who wrote and posted on their account? No, it was all done by them. Just AI kind of assisted the review writing process of it, but at the end of the day, it was them who consented and who posted under their own account. So now using this strategy, you can collect a lot more reviews in more sophisticated way where it gets indexed for every keyword that you would be known for. And that's probably the easiest and cheapest marketing strategy that you can ever use. Collecting reviews is free, right? Why not leverage it, right? Why not use it as much as possible rather than spending all kinds of money? Of course, I'm not saying that that's not bad. That's not, it's a horrible thing to do. I mean, you're going to get results on paid ads and whatnot, but it's just when you turn off the paid ads, it just disappears. But those reviews that you have collected, they become your digital asset for you. So that will be long lasting, and it will always be indexed when someone's looking for thermal extractions or endodontics and whatever the case might be. Hopefully that makes sense.
No, it makes perfect sense for sure, Eddie. So I do see the focus on especially the practice. And I think today we're really talking to the SME, the small, medium practice that is trying to grow and scale. And like I said, I've seen practices, again, that they have, let's say, a staff of 3 or 4. I've seen them, with a staff of 25, 40, like and be see 85, 100 patients a day. I mean, they get to that, as they, get that operational load, and scalability. I think that for the small, the one that is really, the family practice, the one that is really like I call them anchors in neighborhood cities. You want that. Why? Because most people, let's say, I think we were discussing before we started the podcast, about how basically developments happen, especially for housing and everything that we see. We're talking to cities. Well, guess what? Cities are not only looking for homeowners, or houses to be built. They're also looking to what? To have retail shops that provide health services like dentists, doctors that can take care of those people that live around the area so we can make them convenient. You become then a pillar in the community because people are going to remember where your practice is. So also online, you're going to have an exposure. You want to use that as a tool for you to acquire and attract more patients. And of course, supporting yourself with an expert like Eddie doesn't matter where you're at in the country, right? Like it's safe to say you work nationwide, with clients.
Yeah, it's virtual and online services. We're not bounded by um, distance or location. But we do, as far as like the marketing side goes, we don't want to self compete. So we don't want to serve like having 2 Starbucks in one block. And we don't want that to happen. So we are selective as far as who we choose to serve. Again, I don't want 2 ophthalmology office competing for the same pool of patients around them, right? So our policy is that we don't serve any same type of business within 5 mile radius if it's a local business.
That's interesting because it is the same way as we look at prime capital for clients. I mean, most people come and say, okay, I want the cheapest money. I'm like, all right, well, your tiering doesn't allow you to get that, because maybe you have some issues, either credit, operational, financial, fiscal, issues that you need to work on. And it's basically being selective on what clients you can really apply your methodology, to be able to scale them, right? Let's bring it all back and say, I want to talk to Eddie. How long, when people are looking at this, how long can people expect to, let's say, start working with you? How long is the process? And start seeing results and put those businesses in the map and really work on patient acquisition and retention?
So the results, that's the very sensitive part, right? Because that's what people are probably, not just the dental practice owners, but just many business owners are most interested about what is my ROI is going to look like and when will this ever happen, right? Quite frankly, when you're trading money with visibility, campaigns, which stands for cost per click, you're going to get the results right away, actually, because you're literally trading money with exposure, the visibility, and that's what you're paying for. You're doing the shortcut, right? Get in front of when some people is typing certain keywords, you want to be in front of them right away. And and Google knows that. Google knows that, Yelp knows that, and they use that data to solicit their service. And I get probably 85% of their revenue is probably coming from those type of services that they provide. So when you want to have results right away, yeah, go ahead and turn on CPC and you're going to get the results probably within the first month, depending on the budget that you put in. So, but the long run, For the long run, the marathon part is where you have to progressively keep building the digital asset. Like I talked about reviews. You cannot collect thousands of reviews overnight. Okay. That would be considered as hyperactivity, which Google will red flag your business and possibly take away your Google business profile. Right. The same thing with Yelp. So you can't do that. You have to slowly and progressively build your presence. But then this have a long lasting effect. So you kind of think about the short-term goals and the long-term goals. Short-term goal, you want to have a cash flow right away, which means that, yeah, let's do a go-to-market strategy where you're spending some money for immediate exposure. Okay, let's go to Google, let's go to Meta, let's go to TikTok, let's go to wherever people go to find stuff and then be in front of them, right? Yeah, typically that will give you a result within the first 3 to 4 weeks. Whereas GEO or SEO will take, I don't know, depending on the competitiveness of the keywords, could take up to 4, 5, 6 months. But yeah, so the ROI and the timeline part, again, it really varies depending on what your strategy or the priority is.
Well, and I think that you mentioned that, well, it can be impactful as soon as possible. As soon as you start working with Eddie, you can get to that. If you don't mind, I want to show your website, so people can, basically go and click and
Yeah.
see kind of like your capability statement, really what you guys do with Ditans Group. So if you go to ditansgroup.com, and if you're looking at the screen right now, you're going to get to basically his website. You're also going to see, basically the clients that you serve, but the services. I wanted to point out, that you do help horizontally and vertically integration of solutions for clients, that we are discussing that are listening to us right now. The website design, development, the search engine optimization, that's key basically, to put your company in the map. Influencer marketing, which, is something I'm sure we can dive into and in another podcast. Social media management, CPC, paid advertising, marketing materials, call tracking, and review management. That between some of the pieces basically of the marketing side, and we haven't talked about all the other building and kind of like, the boring paperwork that I'm sure the dentist was not looking to. when we get into these businesses, we're thinking, oh, I love to do this, and then you start, just start doing a bunch of things that you don't like. I'm like, oh my god, this is incredible. But that's why you got to outsource it. You gotta get with the experts. Eddie, just basically to wrap it up, and then kind of get a call to action. What message do you want to tell right now to struggling, or maybe, you're successful, but you want to scale and grow and work with Eddie, with your practice? What is the call to action today?
So the call to action for Ditans Group, specifically for the digital marketing side, is you want to know what your position is. You want to know what your current standing is. So, well, just like you're going to doctor, you have to first find out what the problem is. And then you start making interventions and you start making treatment plan based on what your root causes of what problems are. So if you like to see what your current ranking is on Google, and if AI is finding your website or your business, yeah, please contact us. We'll do a free analysis for you. We'll do a free competitor analysis for you, so to know who you're up against. And then based on that, we'll give you kind of the roadmap and the action items so that you can take those action items. And without really, even if you're not purchasing services from us, you can take that diagnosis and then take it to any other doctor, and they will probably provide the same type of interventions based on the problems you have. So if you want to have these type of diagnosis or analysis from us, please contact me at Ditans Group. And you have the link. I'm sure you're going to have the link on the podcast, right?
Absolutely. We're going to put the links, for ditansgroup.com in the comment section. Of course, please like, subscribe, and then tell us, hey, do you agree, with the challenges that we see with practices? Maybe you're a practice owner and you want to comment and say, you know what? No, this is the biggest problem I see, and I didn't see it in the discussion that you guys had today. Of course, we also want to give a shameless plug, from our end. We are basically also traveling all over the United States, working to be able to help and attract, of course, new young entrepreneurs that are looking right now to basically get into the workforce, and maybe they're not finding those jobs, or maybe they're not in health, which health it's a great industry because you are basically needed. Well, all of these discussions are guiding us to the retail side. And we are currently right now, and if you're looking at this podcast, you may have missed, but us, with myself, with Evermar Capital, I'll be a speaker at the Great American Franchise Expo coming up on Miami in April 18 and 19. And we will be there. So if you have any questions about, hey, I want to look into, some healthcare brands and industries that we want to get to for health and wellness, and you want to be a business owner, you want to own your future, you want to break free from employment, feel free to book a free consultation with us. As you mentioned, Eddie, you also give a free consultation that you can at least do. It's a checkup. It's like a doctor's checkup, free of charge for you. And, remember that we have those tools available for you as well. Eddie, I really want to thank you so much for talking to us. I find really interesting, this piece, because I think this is the piece that a lot of good people. I've met so many good doctors, good people that really believe in community. They care about the people that they serve, being a doctor, being a dentist. You do it for the love of caring for others. But they need the help of experts like you to help them on this piece. And that helps them expand, and they can continue to live their mission and their purpose. So I do believe that you are a big part of what makes small businesses, doctors and dentists, being able to scale and thrive, not survive only. I want to thank you so much for that, Eddie.
Thank you for having me.
Absolutely. Well, of course, if you liked everything that you saw today or that we talk about, please follow, like, subscribe, get the notification button, of course, click in, and we will see you in the next podcast.